Good morning, everybody, and welcome. We're really glad to have you here. My name is Caleb Banta-Green, and I'll be part-time MC for today's Focus on Meth, Washington State Symposium on Methamphetamine. And I'd like to start us today with a land acknowledgement. And I want to state specifically, I really want to begin by acknowledging that as we gather today across Washington State and even broader, we are on the ancestral homelands of the indigenous peoples who have lived on these lands since time immemorial. And I hope you'll join me in expressing our deepest respect and gratitude for our indigenous neighbors. And I think particularly today, as we talk about methamphetamine, thinking about the impact on these communities and how we can be of service to them. Our objectives today broadly are to raise awareness of the use and impact of methamphetamine in Washington State, especially in the context of opioid use and overdose, and really to generate conversations to promote understanding and new ideas, really for you all to contribute something and learn something new that you can take back to your community to take action. And I really want to thank the Washington State Healthcare Authority, the Division of Behavioral Health and Recovery, for funding and supporting this event today as they have for several years. And so with that, I want to hand it over to my colleague, Tony Walton.
Thank you, Caleb. Good morning, everyone. I want to also welcome everyone on behalf of the Washington State Healthcare Authority. My name is Tony Walton. I'm the Section Manager of Adult Substance Use and Treatment at the Division of Behavioral Health and Recovery. And we're happy to partner with the University of Washington's Addictions, Drug, and Alcohol Institute on a number of projects that look to support individuals who use drugs, including the 2025 Meth Symposium today. Wanted to start with just summarizing a little bit of data, and I know that's going to be a major presentation later on, but I did notice that according to the ADAI Major Drug Interactive Dashboard, based on mortality and crime lab data, that meth-related deaths have been increasing over the past decade. Similar to fentanyl and opioid, preliminary 2024 data show a slight decrease, which is promising. However, we won't know more for sure until all 2024 deaths are finalized. I think the fact that the number of individuals that are coming to attend this symposium keeps rising. It started at 170 and now it's up to 224, shows and indicates that everyone understands that this is an important topic. And so these data indicate, and we continue to recognize collectively, that methamphetamine use contributes to a great deal of substance-related harms across Washington State. Our tools to support the health of people who use methamphetamine have some similarities, such as traditional SUD treatment, residential treatment, but also many differences in other substances, such as alcohol and opioids. There isn't an FDA-approved medication to treat stimulant use disorder. But I did review a stimulants and health handout that ADAI developed, which noted there are medications out there that can help someone reduce their stimulant use and help them feel better. And there's also a presentation later on today about methamphetamine treatment using medications. So in addition, Washington State continues innovative efforts to reduce stimulant use and support individuals who use drugs through innovative programs like contingency management. In 2021, we began piloting in various settings contingency management using a combination of federal and state dollars. And then in June of 2023, Washington State became the second state in the nation to roll out this evidence-based treatment as part of an 1115 waiver. Contingency management, along with other techniques and interventions, and some of the stories you'll hear about today, offer a client-centered approach that incorporates harm reduction, healthcare, treatment, recovery supports, which are our best chance at supporting the health of individuals who use methamphetamine and other drugs. This summit is crucial to ensuring that we center our collaborative efforts on all the various licit and illicit substances which impact the health and wellness of individuals who use drugs, and in doing so, continue to help support health equity efforts across the state. Finally, I wanted to extend appreciation and gratitude towards those in attendance today. Whether you're in direct services, research, policy work, administration, government, you're taking time out of your schedules with the sole focus of supporting this population and learning more and collaborating and trying to do what we can collectively to help reduce the harms and increase the wellness of people who are suffering. So thank you to everyone for attending, and I hope you have a great day.
Great. Thank you very much, Tony. I really appreciate that. And we've been very fortunate to collaborate with Healthcare Authority for many years. So I appreciate you joining us this morning. So I want to give a little bit more background about why we're having this event and introduce myself a bit more. So again, my name is Caleb Banta-Green, and I'm a research professor here at the University of Washington. I'm with the Addictions, Drug, and Alcohol Institute, and I specifically direct our Center for Community Engaged Drug Education, Epidemiology, and Research. And my work actually started at ADAI back in 1996 as a social work student, and worked with a medical anthropologist to do extensive qualitative interviews with men who have sex with men and inject methamphetamine, who continue to have very high HIV rates. And in the midst of multi-hour interviews with folks, one of the things I think is so important, and you'll hear it throughout today, is we need to understand the context of substance use, the social context, the motivations for use, the reinforcers for use, why people use, if we want to be of service to folks as they want to manage their health, stay healthy and safe, and if they want to reduce their use, support them in ways to reduce use. And you'll hear this many times today, but this is really a period of ongoing services and supports for folks as they work on different aspects of their life. And it may not be the methamphetamine use that's the thing that they want to work on. And so we need to be mindful of that. We had our first symposium back in 2019 in person on campus at the University of Washington. And sort of like today, a really wonderful, diverse audience, a lot of folks with direct service, some folks with lived experience. We had some local policymakers as well as some media, and I really think it helped feed a good conversation and a broader understanding around methamphetamine in particular, and there was a lot of good things that came out of that. One of the things that our group does is provide a lot of implementation support to clinical programs all across the state, healthcare providers, substance use disorder providers. We're also working in collaboration with housing and harm reduction providers. And I think what we really started trying to do 6-7 years ago around stimulant use disorder in particular, kind of I don't know, innovation is a strong word for it, but the change we really tried to make was particularly for folks who were using heroin or eventually fentanyl, we were really trying to say, well, hey, our innovation is to actually allow people to start treatment medications for opioid use disorder and even stay on them as their stimulant use persists. We're not going to try to really tackle the stimulant use, but we're going to at least allow those folks to get started on care. And we know that being on those treatment medications is a benefit. So that was great. That was wonderful to engage people in care. But in some ways, we haven't done enough. And as we've seen, and I'll show in a few minutes, with a large increase in overdose involved deaths, there's more to do. And there's more to do directly around stimulant use, not just ignoring the stimulant use and providing other care, but really making sure we're offering a rich array of services and supports to folks who use stimulants. And so I think that's a big difference between 6 years ago and today, is as there's more to do. And we're really going to dig into that today. I think we've got some really exciting new processes and materials that hopefully will be a benefit to you and your community about how to engage people who are using stimulants, about whatever their needs are today, and offer them an array of options that you're willing to work with them on over time. Whether they're doing well or whether they're not doing well, we want them to keep coming back. And we've got a lot of different things that we can do to be of service and help support folks' health and safety. So I want to go into a little bit about our objectives today. So this is the amazing opening right now. I'm going to talk with my colleague Brian in just a few minutes. We're going to do a conversation on methamphetamine use in Washington State. We will do a short break. We like to take mini breaks in these virtual meetings to give you a chance to stretch. Then we're going to talk about no single path, hearing about people's personal stories related to methamphetamine use. We'll take another break. Then we're really excited to have a panel of wonderful people from across the state giving us harm reduction pro tips. And then we'll take a lunch break. And then we're going to talk about treatment medications for stimulant use disorder and for people who are using methamphetamine. We'll take another break. We're going to talk about a particular interventions you may have heard about called contingency management in non-treatment settings. We'll take one last break, and then we'll talk about whole person healthcare, and then we'll move into a closing session. So, housekeeping, really excited to see so many people here. We are using something called Zoom Webinar, and presenters are going to be on screen while the audience is off camera and muted. You please submit questions in the Q&A box. You'll see a link. Look around your Zoom screen, find that Q&A box, and we will look at those and then try to do our best to respond to as many of those as we can today. And those we can't respond to today, we will follow up with kind of an FAQ after this session. And the sessions are being recorded and will be posted on this webpage. This webpage is great already, and it also includes the link to the 2019 symposium. You can actually see all of that. That's those sessions as well if there are things there that are of interest to you. So those are our housekeeping things for today. So now we're going to have a quick poll about who is here. See some folks putting things in the chat, which is great. Good. So here are the poll results. And if you want to also put in the chat with your background, that'd be wonderful. Really happy to see we've got folks with lived and living experience here today. We have behavioral health, primary care providers and administrators. We have care managers, navigators, peer support, harm reduction services folks, governmental agency and policy people, tribal, urban Indian colleagues, criminal legal system colleagues, folks working in housing, public health, and then I see people are putting in the chat some other things that they're working in. So we are so excited to have you all here. It's going to take all of us to support both individual people in our community, make sure they're able to access a community of care, and really work together to take a community-based approach as well, which includes both providing services as well as providing good education and information to community members who have very understandable questions and concerns about how to support the health of folks who are using methamphetamine. Okay, just getting the lighting right. Welcome back, everybody. Hope you got your coffee. I'm really honored to welcome Priscilla Blackwolf with Yakama Nation here today to give us a blessing. So Priscilla, if you would please say a blessing, we'd really appreciate it. Thank you for being here.
Yakamaitski Winikshаш Nikum Kushia Patumki Priscilla Suluskan Blackwolf. And I'm going to go ahead and offer a blessing. Nami Anisla, our great creator. Nami Inmi Piep, our big brother Jesus. Kwafanu Kukutlama. Today we ask a blessing upon the workers and the words and the methodology that is being developed for the healing and all of the healing for all of the people as we have in every community now, the unhoused and the addicted people to whatever it may be. And we ask a blessing upon your land and all the lands where everyone is, mainly for our people. And we give all the praise and glory to all of you for all that you are developing, and hopefully that it will be healing, hope, and love and forgiveness in our daily walk in life. Thank you very much. Good luck, Christian.
Thank you so much. We're really honored and thankful for your blessing, and I appreciate you, the warmth and kindness you're bringing to this. So thank you very much.